An important part of the gross anatomy of bones is what's called the bone markings. And this will be important, especially for lab also. These bone markings are important because they're the sites for muscle, ligament, or tendon attachment. So when you actually go into the lab or go to the Learning Support Center and feel the bones, you're not going to feel a lot of smooth surfaces. You'll feel different bumps, and those bumps do have significance. For example, there's three types of markings. There are projections, which are outward bulges of bones. These are areas that are due to increased stress from muscle pull. There are depressions like bowl or groove-like cutouts, which are passageways for vessels and nerves, or play a role in joints. Then there are openings like holes or canals in bone. These could be things like foramen. So our next slide is very important, and I would encourage you to make a note card for each of these and some of the examples. So this chart is grouped into those three different bullets from the previous slide. We have the projections, the depressions, as well as the openings, and then some other surfaces that form joints. So let's look at the projection first. We have a tuberosity, and a tuberosity is where a muscle is attached. So, for example, in the humerus, there is what's called the deltoid tuberosity, where the deltoid muscle is attached. In this chart, we have the ischial tuberosity, where gluteal muscles are attached. Or I'll just even generalize that. It's just where a muscles are attached. And that's on the hip bone. And this is the combination between the ilium, the ischium, and the pubis. We then have crests, which are usually prominent, like the iliac crest. Trochanters, which are found primarily on the femur. So we can see a couple of trochanters here. This would be the greater trochanter, and this would be the lesser trochanter. We have lines, which are narrow ridges of bones, less prominent than a crest. So this is called the intertrochanteric line because it's between both the greater and the lesser trochanter. We have what's called a tubercle, and a lot of times these tubercles, there's some that are on the humerus, but there's also some on the femur, like the adductor tubercle. And on the humerus, there's a greater and a lesser tubercle. So I'll put here also on humerus. For your lab, there will be a list of various examples of these. So if you know what these words mean, it'll make your life easier in lab. So let's say there's 7 or so tuberosities that you have to know. So for example, on the tibia, there's what's called a tibial tuberosity. Then there is an epicondyle, and an epicondyle is above a condyle. The prefix epi means on top of. Just like in chapter 1, you learned that the epigastric area is on top of the stomach. There is the spine, which is a slender, often pointed projection. And in the vertebrae, if you feel or if you touch the posterior part of your vertebrae, you will feel the spinous process. We saw a medial epicondyle here. and this is the condyle, and then the spinous process would be the other example. So those are all the examples of projections for sites of muscle and ligament attachment. The next group is what forms joints. So there is a head of the rib, which is shown here. There's a facet of the rib. There's also facets for the vertebrae, which you'll see especially when you get to the joint chapter. Then there are condyles, which were mentioned up here as well. But in this case, this is a really important condyle, and it happens to be called the mandibular condyle. And what's really cool about condyles is a lot of times those condyles, like this one, the mandibular condyle, the condyles a lot of time form joints by fitting into fossas. Fossas are sometimes rounded like depressions, and in this case, the mandibular condyle on the mandible bone, as you can see here, is going to fit into the mandibular fossa, which is actually on the temporal bone. So if you take a minute to feel your TMJ joint, you will feel the mandibular condyle here fitting upwards into the mandibular fossa on your temporal bone. The last one in this section is, again, that condyle, and it oftentimes articulates with the fossa. So the condyles and the fossas are very, very important. The last group of bone attachments are depressions or openings for blood vessels and nerves. So the first is a groove, which is a furrow. You can see a groove here on the mandible. Then there is a fissure, which is a slit-like opening. And this is called the inferior orbital fissure. It's a slit-like opening, which is actually found in the very posterior region of the orbital socket. The next one is called the foramen, and there's lots of foramen. The foramen are really important. So they're openings for nerves or blood vessels. So we are seeing a foramen right here. In fact, it's called the infraorbital foramen. So you may need to know that for lab. Also, up here is another foramen called the supraorbital foramen. And again, your lab instructor should have a list of exactly which ones you'll need to know. The notch is a indentation in the edge of a structure. And there's others like meatuses, which are canal-like passageways. The most common meatus is the external auditory or the external acoustic meatus. A sinus is a cavity within a bone. So we obviously know where our sinuses are. This is called the frontal sinus. There's also maxillary ethmoid and sphenoid sinus. And then there's those fossas, which I mentioned. The condyles can fit into the fossas. This is one example of a fossa, but there'll be others that you'll also need to know.